What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, or a test for some other virus, I hope you have tested negative. If you did test positive for any of the viruses, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Tuesday edition of the Virus Update for Tuesday, April 8th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update for all those viruses that can make us sick. There's a lot of viruses out there, and over the last several months, there were a lot of people that were sick, and yes, deaths from the viruses, they're still a thing as well. Just yesterday, you saw that there were well over 500 new COVID deaths reported in 1 week here in the United States. Yeah, a lot of people don't realize people are still dying of COVID, but they're dying of other viruses as well. You need to be informed with what's going on with these viruses. That's what I do here on my channel each and every day. I give you the latest news, data, wastewater data, anything I can find to help keep you safe and informed on what's going on with these viruses. Alrighty, so if you're new to my channel, subscribe down below, give this a thumbs up, hit that notification bell, share this video with anyone you know, leave your comments down below, check my website, datareport.info, and of course, follow me on social media. The links for that will be down below. We do have several news stories today. We have several measles stories. We do have some daily data to look at. We have some data from New York, Pennsylvania. We're going to revisit Walgreens, and we're going to take a look at wastewater. We got a problem. One region in the United States that I mentioned last week continues to rise for COVID on, keyword, wastewater scanned. Yes, that website. So we'll take a look at all this. Starting off with some breaking news that literally just came in within the last couple of hours. This came out around 2:30 p.m. Remember the other day we were informed that there was an H5N1 human case in Mexico and a 3-year-old girl. Well, apparently that girl has now died. Yes, this is a real quick turnaround. We found out about it, I believe it was just over last weekend, and already we're finding out this person has now died. The 3-year-old girl has died from H5N1 bird flu. So, yes, this is not good news whatsoever. Moving on to this now. Indiana confirms its first measles case in more than a year. Yes, Indiana now joins the growing list of states that are dealing with measles cases. Texas provided an update today on their measles situation, and unfortunately, their measles cases have continued to rise. They are now up to 505 cases. Yes, they have gone over the 500 mark. Gaines County, Texas holds the most cases with 328 cases. Lubbock has 36. Terry has 46 cases. Looks like Dawson County now has 20 cases. On and on I could go. The number of cases just continues to go up. 495 of them are unvaccinated or unknown status. 3 of them had 1 dose of the vaccine. 7 of them now had 2+ doses of vaccine. I don't know. Did that number go up? Either way, that equals 10 that were either partly vaccinated or fully vaccinated. So you get the idea here. The majority of them were unvaccinated or unknown status cases. The United States last update last week was 607 measles cases, and with that, that number is likely to go up significantly. Why? Because, well, that number is going to go up because you just saw Texas added cases. You do have the case in Indiana, and I don't know, do I have this queued up here? There is another case that we need to talk about. No, I guess I don't have it queued up. There was also another new case reported today in Colorado. Colorado added another case of measles. I believe that takes them to 2 cases now. Ontario's measles outbreak is really getting big. In fact, it's so big. Even New York state health officials here in the United States are taking notice. Measles is only a car ride away, says New York travel advisory that warns of cases in Ontario. And yeah, it's true. The measles outbreak in Ontario has been really getting big, but I said it before, I'll say it again. I think here in the United States, I think we are eventually going to pass what's going on in Ontario. And it says the advisory notes that Canada's outbreak includes more than 600 cases. And, well, we've already passed that. We have 607 here in the United States. But you get the point here. Measles, it's not just a problem there. It's a problem in Canada. It's also a problem in Taiwan. Taiwan reports 3 new measles cases. Source of domestic infection is unclear at this time. And now get this, in the Chicago metro area, tuberculosis case confirmed at suburban Joliet High School. Yeah, we've been watching TB cases. And did we not just talk about a case there in that area about a couple of weeks ago? I'm pretty sure this is a separate case. Not a good thing that there's 2 cases there. I remember Kansas, down there in Kansas City area, I believe it was. They're dealing with a full-blown outbreak. I hope this is not also turning into an outbreak. All right, wanted to show you this. I was hesitant as to whether or not to show you this or not. Data remains unclear between asthma and the prevalence of COVID-19. And you know what? I can tell you something. They're talking here about asthma, how it's increased globally. And they're saying the data remains unclear. Well, I can raise my hand to this one. Prior to being sick in 2020, which was suspected COVID, and now what was definitely COVID a couple of months ago, when I had another case of COVID, I never had asthma. Now, mind you, I'm on treatments now, and it's a lot better than what it was, but prior to being sick with suspected COVID in 2020, I never was diagnosed with asthma. And my asthma, like I said, it's gotten better now because it's controlled, although I don't know what's going to happen in the summertime, given that I've had COVID. Who knows? Maybe it gets bad again. Knock on wood. I hope it does not. But the point being made is I can raise my hand and say that I have gained asthma from COVID. And I think a lot of people can. But they're saying, the data's unclear. We don't know if COVID's causing it or not. And you know what? I think a lot of people are going to probably find out that, yeah, it is because they have had COVID. And this is not the first story about it. If you want to read this full story, you notice here, we're not reading a full story. But if you want to read this full story, you can. And it is also saying that we need to see what happens over the next 3 to 5 years. Yeah, that's a real problem. There's a lot of things with post-COVID that we do not know what is going to happen over the next 3 to 5 years. Remember, this is a waiting game. We rush to get back to normal. Should we have gone back to normal? In some cases, yes. Some cases, no. I mean, I'm not going to say I'm not going to sit here and debate what should have been rushed back to normal, what should have not been. But the point is, we did it when there was a lot of unknowns. We were like, oh, we're in a better place now. We're actually not in as great of a place as many people say we are. Why? Because we don't know what the long-term effect is going to be of this virus. We really don't. There are still constant waves. I mean, we're doing 2 waves a year, sometimes more. I mean, last summer was like the wave that wouldn't end. It started in May. It went straight through to September. Finally, it was down in October, and then we had whatever we had during the winter time. You get the point. We're still dealing with these constant waves, and we know repeat infections are not good. And we know repeat infections increase the risk of long-term problems, such as asthma, such as everything else that we talk about here on the channel. So, yeah, we're in a waiting game for not just asthma. We're in a waiting game to see what happens with a whole lot of things. And I think in the end result, we're going to find out, whoa, there's a lot of people that are dealing with long-term complications that could be traced back to a COVID infection. Here's the problem. Many people don't want to do that. They want to say, oh, well, it wasn't COVID. COVID's no big deal. Well, yeah, you say it's no big deal. That's what you were told, but in the end, it really is a big deal. Moving on, could ramble on for a very long time. Italy COVID cases over the last 30 days. 1,386 cases, 18 cases among healthcare workers in the last 30 days. The median age is 70 years old. 46% of the cases are males, and 53.2% are females. I find that interesting because there was once a study that said females could go on to have a higher risk of long COVID. I think, as a matter of fact, at this point, I think there have been a couple of studies that say that. It's just interesting that more females have tested positive there than males. 38 deaths in the last 30 days, and 725 people have recovered. It looks like overall their cases at this time are trending downward in Italy. New Zealand, I'm going to make a note to myself that we add that tomorrow. I was talking about a moment ago things being traced back to a COVID infection. That's one of the things that I am starting to do on my site. Now, I didn't do any work on the archives last night. Really, that's the point of my site. It's an archive. It's the internet's virus archive, or the internet's COVID archive, I guess you could call it too. And I'm finding out a lot of basketball players have had COVID, and I'm gonna be adding more of them because I'm trying to trace back all these sports illnesses to see did they have a COVID infection? Because for some of these sports players, it is time and time again they keep getting sick, which is just very bizarre and very concerning, and pretty much matches up with some people who have immune system damage left behind from COVID. Taking a look at bird migration. Why do we look at that? Bird flu is a problem. You just heard about a bird flu death down there in Mexico. So we like to see the migration of birds to see where potentially there could be increased risk of bird flu. And we do see in the plains today there is pretty heavy traffic when it comes to bird flu migration. Maybe not so much in the east today, and you're not really seeing much of anything. I got to be honest with you, it's cold. It's 46 degrees here today. Yeah, we're in April now, and we're back to winter temperatures, so the bird migration might have slowed a little bit for the time being in the east. Taking a look at what's going on with air qualities, and you will see that for the most part, it's okay. You can see the east is fine. Definitely something going on here in the plains. It'll eventually come up, but you can see there in Kansas and Nebraska, there's some oranges. Yeah, look at that. Even South Dakota, reds, even a site that is purple. Yellows in Oklahoma and Texas, and some problems on the west coast as well, although not too bad. California is the worst state at this time. Taking a look at what is going on in Pinellas County, Florida, and with that we see, wow, not one, not two, not three, not four, not five, 6 sick person calls, and a whole bunch of other things at this time. That's not a good thing. In case you don't know, Pinellas County, Florida, Clearwater, Tampa Bay, St. Petersburg, that area. Philadelphia yesterday, 788 EMS incidents. That's still below 800, so that is good, but it is much higher than Sunday. Sunday was below 700. Taking a look at what's going on right now in Montgomery County, Pennsylvania. Mind you, it's 5:30 in the evening. This is a lot of calls. I'm seeing cardiac emergency, not once, not twice, 3 times, respiratory emergency a couple times, and a few other things going on at this time. Seeing fever show up, nauseous and vomiting. Yeah, that's not good. And in, Chester County, Pennsylvania, a lot of calls for this time of day. Sick person, 1, 2, at least 3 times, respiratory emergency, heart problems showing up a few times, abdominal pain, injured person, emotional disorder. Yeah, a lot of things going on there. Let's see how that translates to the hospital situation. And that translates to Southeast Pennsylvania. Is not bad right now, but Lehigh Valley, Pennsylvania. Yeah, a lot of hospitals in yellow. Let's click on some of them. Behavior health. Actually, we can just do it this way. Yeah, Lehigh Valley. I'm seeing emergency department. Near capacity. Yeah, behavior health diversion. There's a lot of hospitals dealing with problems in Pennsylvania. That is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Almost around 18 hospitals dealing with problems in Pennsylvania today. That is not a good thing. Here's something that is a good thing. Wastewater levels in Pennsylvania for COVID today. Low. Wastewater levels when it comes to, first take a look at this. LP 8.1 is the leading variant in Pennsylvania, and that leads by 35.9%. And then we do have this other category that's 19.36% at this time. We do see influenza A is low at this time in Pennsylvania, and RSV continues to be low. RSV is dropping at this time. All 3 are dropping. Still not seeing that spring rise for COVID yet, Pennsylvania. Let's hope we do not see it. All right, here's a little bit more of what's going on in Pennsylvania. Activity through April 5th. Influenza trends. Influenza activity is still above the baseline, but continues to decrease. 222,588 laboratory confirmed influenza cases have been reported season to date from September of last year, end of September, through April 5th. The percent of emergency department visits resulting in influenza diagnosis is decreasing for all ages statewide. And as of March 29th, new hospital admissions for influenza were decreasing for adult and low for pediatric patients. 926 influenza-related deaths in Pennsylvania. That's pretty bad, but hey, COVID's worse. COVID had 1,062 COVID-19 related deaths were reported for this season in Pennsylvania. As of 3-29, new hospital admissions for COVID-19 are decreasing for adults and are low for pediatric patients. The percentage of emergency department visits with a COVID-19 diagnosis are low statewide for all ages. RSV trends. Activity is still above the baseline, particularly for older age groups, but continues to decrease. And it looks like there are 46,072 laboratory confirmed RSV cases. And it looks like admissions are decreasing at this time, but hospital admissions in adults are still above the baseline. I'm not seeing deaths here for RSV. Let me click on deaths. No. It doesn't look like they're talking about RSV deaths at this time. But I do want to show you this real quickly. And we showed this in Montana yesterday. Take a look at influenza deaths in Pennsylvania. While COVID deaths have been trending lower, influenza deaths are, unfortunately, trending upward. Take a look at this. You can see here, 2020 to 2021. We had 30 influenza deaths. 2021 to 2022, 159. 2022 to 2023, 434. 2023 to 2024, 503. 2024 to 2025, 926. Yeah, that's not a good trend. And we keep this trend up. Mind you, we're not done with this year. Keep that trend up. Next year's going to be over 1,000. What is going on here? We need to do something about this. All right, moving on to New Jersey. Just a couple of hospitals dealing with a few issues today. Nothing major. New York State, 588 new cases have been reported today. Taking a look at New York State hospitalizations. Yeah, they are higher than where they ended last week, 763. But then that's where they ended last week. Today is 801 and 83 people in the ICU. But here's good news. When we take a look compared to last week on this day, that report was 813. Now, a little bit of bad news still, though. New York City, the hospitalizations have hit a new high again for this particular wave, which goes all the way back to, you have to go all the way back to November of last year. And it's 417 people in the hospital, 46 in the ICU. That's a big increase from the last report, but it's also just a slight increase from last week at this time. All right, taking a look at Walgreens, the national flu positivity rate is 2.71%. And when we take a look at COVID, the COVID positivity rate is currently 16.3%. That is up by 1.4%. But there is something I want to do here. I want to show you this as a table because, mind you, this level has been increasing, and I need to scroll this way down all the way up to this year, so bear with me for a moment. But you can see here on the chart, you see the flu positivity rate has been trending higher since the COVID positivity rate has been trending higher since February 3rd. And a part of the problem is testing has been dropping, and here we go. We're starting to come into it now. Here's 2025. You can see here, testing, it peaked on or about February 1st, or we'll say in February it peaked, but then look what happened. Testing started to really drop. And as the testing was dropping, the positivity rate continued to rise. We're up to 16.3% as of the most recent update. And if we go all the way back, we can see the positivity rate back in January actually was around 9.8% on January 31st. That's a pretty big increase. Some of it is cases in some states, but the majority of this is the drop in testing. We'll have to continue to watch this, though, because eventually cases are going to cause it to go higher, too, whenever the next wave comes. All right, I got to show you what's going on in wastewater scan. And first off, we're going to take a look at the nationwide level. And here's the nationwide level. And we can see here, nationwide, COVID is pretty much holding steady. Disregard the wonky movement at the end. RSV is high and dropping. Influenza A is high but dropping. Influenza B, overall, yeah, it's still trending upward, as is HMPV. HMPV and EVD68 are low. Influenza B is still high. Norovirus is also high at this time. And to be fair, let's show you we'll show you all the regions. Midwest is dropping for COVID, dropping for RSV, dropping for influenza A, rising for influenza B. HMPV is still rising. EVD68 is rising at this time, and norovirus still high but dropping at this time. The Northeast, this is where we come into a problem. And we can see here in the Northeast, overall, the Northeast continues to trend upward and is medium for COVID. It may go high pretty soon if this continues. RSV is high and dropping. Influenza A is high but dropping. Influenza B, overall, it has gone up. Maybe it's getting ready to go down. HMPV is rising, high. Norovirus is high, but dropping at this time. And I got to show you some wastewater sites. And I'm really concerned with what's going on in Massachusetts. You got Boston and you have Worcester. Boston at this time is high for COVID. It's what they're categorizing at. And overall, it is rising at this time. RSV is high, but holding steady. Influenza A is medium. Influenza B, high, dropping a little bit. HMPV is high and has dropped a little bit. EVD68, low. Norovirus is high, but has dropped a little bit. And we can see some detections of hepatitis A. But again, COVID is rising there. But then we go out to Millbury, we'll say Worcester, Massachusetts. 250,000 population served. Look at this. It continues to go upward for COVID at this time, and that's the one I really want you to pay attention to, COVID there. Let's go down and check somewhere else. How about Stamford, Connecticut? Is that rising at this time? What's that medium? No, but I believe Newark. Newark was still going up. So Newark is the other place in New Jersey that we have problems with. It's these three wastewater sites that are rising. We're going to have to keep an eye on this at this time. And COVID is listed high in Newark at this time. Taking a look at what's going on in the South. The South at this time, it's medium for COVID. Starting to drop, I think. RSV is high but dropping. Influenza A is dropping. Influenza B, it's still rising. HMPV is low. EVD68 may be going up. Some wonky movements there at the end. Norovirus is still listed in the high category. And the West Coast. We cannot leave out the West Coast today. But before we do that, we need to take a hydration break because I don't want to forget about that. Very important to keep yourself hydrated, folks. Today's drink of choice is water. Can never drink enough water. Want to make sure you stay hydrated. It is very important. On the West Coast, we do see that COVID at this time, yeah, take a look at that upward movement. But again, one of those wonky movements. If you X that out, we come down to right about here, and we do see up to March 26th, there was some sort of an increase for COVID in the West Coast. It's still low, but it's something we're going to have to keep our eyes on. RSV at this time is high, but dropping. Influenza A is medium at this time. Influenza B is still high. HMPV is still high. EVD68 is low. And norovirus is medium at this time. Alrighty, folks, that does it for the Tuesday edition of the Virus Update. If you enjoyed this update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. And, of course, leave your comments down below. Don't forget to check out my website, datareport.info. Of course, follow me on Blue Sky. I'm also over on X. And, yes, I think I am going to be making either a group or a page over on Facebook just for, all my things, Data Report. Whether it be for this or the website. Probably is going to be just a page. It's going to be called Data Report. Hey, if that's something that you want, let me know down below. It's something I'm considering creating maybe today or one day this week. Alrighty, folks, I'll see you all again next time, which will be tomorrow. Until I see you again next time, stay safe, everyone. Have a fantastic Tuesday evening. Thanks for watching.